Hello, I'm Q.Kelly, and welcome to Backbiting, my news and review channel. I want to present you some urgent events that I think you ought to know about. I would also like to share some news to feed your soul. Hopefully, Backbiting will shed some daylight on where we're headed as a society and motivate you to speak up about what needs to be changed. Obamacare, 8 million and counting. The requirement that all Americans obtain health insurance motivated hundreds of thousands of people to sign up by the official deadline on March 31st, 2014. At least one person that I know complained that they could not afford a health insurance policy, but signed up anyway to avoid any hassles with the IRS. The same person claims that a year before the Affordable Care Act, the ACA, was enacted, they inquired about an individual health maintenance policy, or HMO, from their state-run Blue Cross and were quoted a monthly payment of $550. Expecting the new Affordable Care Act would reduce that amount, they went shopping around on healthcare.gov and chose a multi-state preferred provider organization, a PPO, from Blue Cross Blue Shield. They were disappointed to find that not only was the quote from the preferred provider insurance a whopping $835 per month, the out-of-pocket costs were also high, $40 for a routine doctor's visit, $60 to see a specialist, not to mention a near $8,000 deductible to be paid up front. Now, only if there was a requirement that every American be hired for a job with a salary commensurate with the high premium cost. Data collection. Many Americans may not be aware that the recent enactment of the health insurance law was preceded by another health mandate that took effect on January 1st, 2014. That mandate states Medicaid and Medicare patient providers must have adopted meaningful use of electronic medical records, or EMR, in order to maintain their reimbursement levels. The way the EMR law is worded suggests that any patient whose doctor serves publicly insured clients would be affected, which could very well be the majority of Americans. The push for electronic medical records coupled with ACA means that Uncle Sam and others will have everyone's medical records at their fingertips. Electronic medical record sharing makes Americans vulnerable to the prying eyes of politicians, government agencies, and private firms. And firms such as telemarketers, researchers, and pharmaceutical companies will be able to purchase personal medical data to further their interests. These commercial voyeurs will be the next generation scapegoats for privacy breaching, as their predecessors, Google and Microsoft, have been. Well, we all know the script by now. On the same topic of data surveillance and your privacy, internet users may have already heard about the vicious program called Heartbleed that sweeps servers such as Yahoo and Tumblr, randomly collecting chunks of information on site visitors. The information Heartbleed obtains includes account holder passwords and PINs, security question answers, etc. Well, who needs the NSA when you have Heartbleed? The littlest victims. 2 crime stories involving children at risk caught my attention recently and should motivate a call for family management training. Both crimes take place in the city of brotherly love. To begin with, a murder committed by perhaps the youngest murderer ever reported, a 2-year-old boy. As mentioned on 6ABC TV's website, a toddler picked up a .357 Magnum revolver, which his older brother placed on the bedroom dresser. The 2-year-old then points the gun at his 11-year-old sister, says bang bang, and then pulls the trigger. A bullet enters his sister's shoulder and exits into her chest. The girl is pronounced dead after arrival at the hospital. The police arrested the mother on a charge of involuntary manslaughter, probably due to negligence. The second littlest victim is also an 11-year-old boy who was struck in the torso by a stray bullet while leaving his grandmother's house. Fortunately, the outcome of this story is less tragic, as the boy survives and the 4-year-old sister who was with him when he was shot is unharmed. It's the guns. Let's strive to do something to curb their usage.